Hello everyone, now let us discuss about muscles of anterior neck that assist in deglutition and speech. The two group of muscles are associated with the anterior aspects of the neck. They are the suprahyoid muscles, so called because they are located superior to the hyoid bone, and are the infrahyoid muscles, named for their position inferior to the hyoid bone. Both groups of muscles stabilize the hyoid bone. Suprahyoid muscles and infrahyoid muscles, they stabilize the hyoid bone, allowing it to serve as a firm base on which the tongue can move. As a group, the suprahyoid muscles elevate the hyoid bone, floor of the oral cavity, and tongue during deglutition, that is swallowing. Now, as the name suggests, the digastric muscle has two bellies, anterior and posterior, united by an intermediate tendon that is held in position by a fibrous loop. This muscle elevates the hyoid bone and larynx during swallowing and speech. In a reverse muscle action RMA, when the hyoid is stabilized, the digastric depresses the mandible and is therefore synergistic to the lateral petroid in opening of the mouth. The next is stylohyoid muscle. It elevates and draws the hyoid bone posteriorly, thus elongating the floor of the oral cavity during the swallowing. The next is mylohyoid muscle. Mylohyoid muscle elevates the hyoid bone and helps press the tongue against the roof of the oral cavity during swallowing to allow food from the oral cavity into the throat. And the next muscle is geniohyoid. It elevates and draws the hyoid bone anteriorly to shorten the floor of the oral cavity and to widen the throat to receive food that is being swallowed. It also depresses the mandible. Glenohyoid bone also depresses the mandible. The infrahyoid muscle are sometimes called strap muscles because of their ribbon-like appearance. And most of the infrahyoid muscles, they depress the hyoid bone and some move the larynx during swallowing and speech. The next muscle is omohyoid muscle. Like the digastric muscle, it is composed of two bellies connected by an intermediate tendon. In this case, however, the two bellies are referred to as superior and inferior rather than anterior and posterior. Together, the omohyoid, sternohyoid and thyrohyoid muscles depress the hyoid bone. Together, omohyoid, sternohyoid and thyrohyoid muscles depress the hyoid bone. In addition, sternothyroid muscle, it depresses the thyroid cartilage. Sternothyroid muscle depresses the thyroid cartilage, which is nothing but Adam's apple of the larynx, to produce low sounds. The reverse muscle action of the thyrohyoid muscle elevates the thyroid cartilage to produce high sounds. Sternothyroid muscle depresses the thyroid cartilage, which is nothing but Adam's apple of the larynx. The sternothyroid muscle depresses. Remember SD or DS in whatever way. And the reverse muscle action of the thyrohyoid muscle. Thyrohyoid muscle elevates the thyroid gland to produce high sounds. Now here you can see the muscles of anterior neck that assist in deglutition, that is swallowing and speech. If you see here, this muscle is the stylohyoid and this one is the anterior belly and this is the posterior belly. This is the anterior belly and this is the posterior belly of digastric muscle. And this muscle is sternohyoid and this one is omohyoid and this are the sternocleidomastoid muscles. If you see here, this muscle is the thyrohyoid and this one is the sternohyoid. The suprahyoid muscles elevate the hyoid bone. hyoid muscles elevate the hyoid bone, the floor of the oral cavity and the tongue during the swallowing. Here is the anterior superior and anterior deep view. These muscles, this one and this one is the sternohyoid. You can see this is the sternum and this is the sternohyoid. This is the thyroid cartilage of the larynx or Adam's apple. And if you see here, this is the thyrohyoid and this muscle is the omohyoid. This is the superior belly of the omohyoid and this one is the inferior belly and this is the intermediate tendon as we have discussed earlier. Now let us discuss about suprahyoid muscles. The first one is diagastric. Coming to its origin, it occurs at anterior belly. The origin of the anterior belly occurs from the inner side of the inferior border of the mandible and posterior belly occurs from temporal bone. Coming to the insertion, it inserts at body of hyoid bone via an intermediate tendon. Coming to the action of diagastric muscle, it elevates hyoid bone. Reverse muscle action depresses the mandible as in opening mouth. It elevates the hyoid bone and the reverse muscle action of the diagastric muscle depresses the mandible as in opening the mouth. Innervation, anterior belly is innervated by mandibular division of the trigeminal nerve and posterior belly by facial nerve. The next muscle is stylohyoid. It occurs at the styloid process. The origin occurs at the styloid process of the temporal bone and it inserts at the body of hyoid bone. And coming to the actions, it elevates the hyoid bone. Diagastric and stylohyoid both elevate the hyoid bone. And in addition, the stylohyoid bone, it draws it posteriorly. And it is innervated by facial nerve. The next is mylohyoid. It origins at inner surface of the mandible. And it inserts at the body of the hyoid. All the muscles they insert at the body of the hyoid. And coming to the action, it elevates the hyoid bone and floor of the mouth and depresses the mandible. And it is innervated by mandibular division of the trigeminal nerve. The next muscle is glenohyoid muscle. It origins at the inner surface of the mandible and inserts at the body of the hyoid. And coming to the actions of glenohyoid, it elevates the hyoid bone and draws hyoid bone and tongue anteriorly. It also depresses the mandible. And it is innervated by first cervical spinal nerve. Glenohyoid muscle is innervated by first cervical spinal nerve C1. Next, coming to infrahyoid muscles. The first one is omohyoid. Its origin occurs at the superior border of the scapula and superior transverse ligament. Inserts at the body of the hyoid bone. Coming to the actions, omohyoid, it depresses the hyoid bone. And it is innervated by branches of spinal nerve C1 to C3. The next muscle is sternohyoid. Its origin occurs at medial end of the clavicle and manubrium of sternum. And it inserts at the body of hyoid. And the actions of both omohyoid and sternohyoid are they depress the hyoid bone. And even sternohyoid muscle is innervated by branches of spinal nerve C1 to C3. Coming to the next muscle, that is sternothyroid. It origins at the manubrium of the sternum and insertion takes place at the thyroid cartilage of the larynx, hence the name sternothyroid. Coming to the action, it depresses the thyroid cartilage of larynx and innervation occurs at the branches by the branches of spinal nerve C1 to C3. The next muscle is thyrohyoid. It originates at the thyroid cartilage of the larynx and inserts at greater horn of hyoid bone. Coming to the actions, it depresses the hyoid bone. Reverse muscle action elevates the thyroid cartilage. And innervation by branches of spinal nerve C1 to C2 and descending hypoglossal nerve. Now let us discuss a pathological condition, that is dysphasia. It is associated with swallowing. This means abnormal fascia is related to eat or swallowing. So dysphagia is a clinical term for difficulty in swallowing. Some individuals are unable to swallow while others have difficulty swallowing liquids, foods or saliva because the causes include nervous system disorders such as that weaken or damage the muscles of deglutition. Whenever the patient is suffering from nervous system disorders that weaken or damage the muscles of deglutition, that is, for example, stroke, Parkinson's disease, cerebral palsy, infections, cancer of the head, neck or esophagus, and injuries to head, neck or chest. So these may cause dysphagia because of the damage to muscles of deglutition. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.